this occasion, Balco Medical Center has organized this webinar on breast cancer prevention and treatment. Today with us, we have Dr. Bhawna Sirohi, our eminent medical oncologist. She has experience of more than 2 decades in India and in UK. Dr. Bhawna specializes in breast and GI cancers and is passionate about cancer prevention, early diagnosis, cancer survivorship, and precision medicine. She is trained in oncology at the Tata Memorial Centre, Mumbai, and Royal Marsden NHS Foundation Trust, UK. She has published more than 120 papers in reputed peer-reviewed national and international journals. And today with us, we have Dr. Bhawna Sirohi, our medical director as well. We are very lucky to have you, ma'am. And thank you for giving us this opportunity to hear you once again. Over to you, ma'am.
Thank you, Priyadarshini. Welcome everyone and good evening from Balco Medical Center, which is a 170-bedded cancer hospital in central India, Raipur. And I joined here a couple of months ago and really privileged to be here. I am going to talk to you about breast cancer prevention and just sharing my slides. So I have no disclosures to make. One second, I'll just make it into a hide presenter view. Great, thank you. So no disclosures. Cancer is something I think all of us will have to deal with in our lifetimes. 1 in 2 or 1 in 4 of us is going to get it. If you Google cancer, almost you get 61.3 crore hits in 1/5 of a second. I know some of you are joining a cancer webinar for the first time. So what is cancer? I mean, your body is made up of trillions of cells. They say about 30 to 40 trillion. And all of these cells do different jobs and behave in different ways. Usually cells divide in a very controlled fashion. From 1 cell becomes 2, 2 becomes 4. Cancer happens when they start dividing in an uncontrolled fashion. And the 2 main reasons for that are usually genes and environment. I'll just talk for half an hour, 35 minutes, and then we'll have a question and answer session for those of you who joined. So cancer happens when an unhealthy cell is there and divides and grows faster than the healthy cells. And without treatment, the number of unhealthy cells or naughty cells grow and can spread to other parts of the body. Quite often what happens is our own immune system is able to get rid of these unhealthy cells. So, if you have cervical cancer, let's say, with human papilloma virus, most of the infections with these infections are self-limiting because your immune system is strong enough to get rid of these unhealthy cells, and that's why the lifestyle comes into discussion. So why does one get cancer? I'll come on to breast cancer, but it's the 3 L's, the lifestyle, which we will talk about and delve into quite a bit. Luck, there was a study from Johns Hopkins and a few other studies which showed that there are some cancers, one is just unlucky or to have it, like brain tumors, bone cancers, or pancreatic cancers. And I think it's because we don't know enough about them. With further research, we'll probably know more about it. And of course, hereditary is something, the genes which we have no control over, which we inherit from our parents. If you look at breast cancer, and if you look at what we know today, if you see most of the world is pink. Pink is where breast cancer is the common cancer in the globe, and India is also pink. Breast cancer is the commonest cancer we have in India. Every 4th lady can have breast cancer, new breast cancer cases. And 1 in 6 cancer deaths are due to breast cancer globally. I'll talk about India, that the incidence of cancer is lower in India compared to the globe, but still because of our sheer population, the numbers are quite high. If you look at the data in India, in Northeast, you will see 1 in 4 in our lifetimes will develop breast cancer. In central India, it's about 1 in 8 to 1 in 13. So it used to be 1 in 25 and 1 in 40 in India, but now we are talking of the same numbers as we did in the West, 1 in 4, 1 in 5. In fact, the figures in the West are that 1 in 2 will develop cancer. So I think it's very important that we need to know about it, and talk about it. So what do we need to do? We need to prevent cancer, which I'll talk about. We need to diagnose it early, and we need to treat it very promptly. Very briefly, I'll talk about risks, because a lot of us say, your risk of breast cancer is high, your risk. So you need to know what risk means. So risk, there are absolute and relative risks. Absolute is your actual chance of developing breast cancer during a time period, usually a lifetime risk. So lifetime risk globally of developing breast cancer from birth to the age 90 is say 12%. But another way of saying that the risk is that your lifetime risk is 1 in 8. Relative risk expresses a comparison. It looks at if you were smoking, what is your likelihood of developing lung cancer. So similarly for breast cancer, it can also be used to actually talk about preventive strategies. That if you do this, your likelihood of developing breast cancer is less or more. And this is what relative risk means. So all women are at risk of developing breast cancer, and I'm going to talk to you about what are the factors that may lead to, that are in your control, and some factors that are not in your control, what we call modifiable factors and non-modifiable factors. So you cannot change being a woman. You cannot change the aging process or your family history or being tall. Now, all of these are in various studies have been implicated as risk factors of developing breast cancer. You can't change having a higher birth weight or being young at your first period or a late menopause. What this means is that if you're young and then late at menopause, that your hormone exposure is more. So that increases your risk of developing breast cancer. And also we can't change the higher breast density. But what you can change is what we'll talk about. And I'll talk about the evidence that has been published in randomized trials. Randomized means half the patients get something and half the patients don't get that thing. So in this study, low-fat diet, half the patients got low-fat diet and half the patients got the normal diet. And what these 3 studies showed, that if you had a low-fat diet, there was a 10% reduced risk of you developing breast cancer. And also, if you had breast cancer, what secondary prevention means is that if you had breast cancer, you had a 25% less chance of the cancer coming back. Low GI diet. This was published this year, and I remember it was presented at one of the big breast cancer meetings in San Antonio 2 years ago. So it talks about glycemic index. Glycemic index diet is to eat carbohydrate containing foods that are less likely to cause sharp increases in sugar levels. So what this study showed, that if you have a low GI diet, low glycemic index diet, your likelihood of developing premenopausal or postmenopausal breast cancer, more effect towards postmenopausal breast cancer, is significantly lower. And I mean, I think we are very lucky in India that we do have a low GI diet with green leafy vegetables, a lot of fruits and veggies and beans and lentils and whole grains. So please keep doing that. Exercise, again, even if you move a little bit, your risk of developing breast cancer goes down. WHO recommends 30 minutes of active exercise where you actually sweat and your heart rate goes up. If you do that, your risk of developing breast cancer goes down by 25 to 40%. And the benefit is greatest in thinner women. Just because you are thin doesn't mean you shouldn't exercise. You must exercise, because when you exercise, you produce different kind of hormones, and it also boosts your immune system, helps in diabetes and cardiovascular diseases as well. So is sitting the new smoking? I won't talk too much about it because it's a lecture in itself. So sitting is not good. You must get up every 30 minutes, because if you sit, your risk of developing, for long periods, your risk of developing breast cancer also increases. So I think it's very important that we remain active. A lot of us, including me, we have sedentary jobs. So put an alarm on your phone every half an hour, try and move about a little bit so that you're not sitting for long periods of time. Any amount of alcohol is bad. There's a 10% increase in risk for breast cancer for every drink per day. Yes, we say that red wine is good or that wine is good, but most of the studies point towards that any amount of alcohol is bad. Hormone replacement therapy. Again, these two beautiful studies showed that if you take hormone replacement therapy, your risk, the hormone replacement therapy in the olden days used to be estrogen and progesterone pill. So if you take the combined pill, the risk of you developing breast cancer is high. But if you take the estrogen alone pill, then the risk of developing breast cancer goes down by 23%. So please discuss with your gynecologist what type of pill you need to take and for how long you need to take it. And this also applies for the oral contraceptive pill. This is a very simple thing, which we can do in daily life, having dinner or supper early. And if you have a long interval, at least 2 hours between your dinner and sleep, your risk of breast cancer goes down by 20%. And if you do both, then your risk goes down by 25%. So I think this is something which we can easily inculcate in our daily lifestyle. And this was a huge study that was done in Spain in thousands of people. So for preventing cancer, you need to, these are the ABCDFs, avoid tobacco, alcohol, sun exposure, not directly for breast cancer, but for skin cancer, pill and hormone replacement therapy, processed food, supplements, and sugar. Sugar is allowed because most of the stuff we eat does get turned into glucose in our body. So 30 grams of sugar is allowed. So sugar is directly related to weight gain. That's why it's part of your preventive strategy to decrease the amount of sugar. B is for be vaccinated against HPV, Hep B, but mainly for us today, be breast aware, breastfeed for at least 6 months if you have had a child. C is calm compliance, that yoga, meditation, stress-free life does help with everything, including breast cancer and heart. Vitamin D, check your vitamin D levels, because there is some evidence to show that vitamin D appears to help breast cells grow normally. So, and most of us are deficient in vitamin D. So get your vitamin D levels checked as well. Diet, we've already spoken about. Try and have a balanced diet, which has more of fruits and vegetables, so that you get your vitamins, proteins, and carbohydrates in a balanced manner. Eat local, whatever is grown locally. Exercise, for E. F for family history. You should know what your family history is, what your mother, grandmother, what your members in your family, if they have passed away, what did they have cancer, and if they had cancer, what age they developed cancer, because that may define when you should start getting yourself checked up. S, I think I put sleep, sweat, stretch, stuff less, eat less. And sleep we've already spoken about. Screening is something which I'll briefly touch upon. Genetic testing, like I said, know your family history. But if anybody wants to ask me later, not everybody needs to undergo genetic testing. If you've had one of your relatives who's had cancer, if they have been young, less than 45 or less than 50 years of age, then yes, you need to have a discussion. You need to have a pre-genetic test counseling before you do the genetic test. So please don't have a genetic test unless you've had counseling done, because it has a lot of implications. How do we diagnose early? Why do we say we have to diagnose early? Because if you diagnose early, you are more likely to be cured. If you look at breast cancer, if you have a tumor up to 2 centimeters and there are no lymph nodes involved, the cure rates are 100%. So early stage, high cure rates, and the cost of treatment is very low, because usually you'll finish your treatment within 3 to 4 months. But if you are stage 3 or 4, then the cure rates are poor and you're literally on treatment forever, and the cost of treatment is very high. I was checking at Balco Medical Center. We have 14% of our patients are diagnosed with breast cancer. Head and neck is our commonest cancer, and 80% patients come with stage 3 and 4 cancer. So I think as a country, not just here in Raipur, we have to change the dynamics. We have to try and move towards stage 0 and stage 1. So what screening methods can you do? Clinical breast exam, very easy, by a trained professional, can be done. I'll talk about it. Mammography for average risk women. By that, I mean all of us have a risk of developing breast cancer being women. So that's average risk. So if you're more than 50 years of age, you should have an X-ray of the breast every 1 or 2 years. So in some countries, they do it every year. In UK, they do it every 2 years. So whatever suits you, but at least once every 2 years, you must have it. So tomosynthesis for younger women, MRI should not be done routinely, but yes, we do consider it in some patients and we can talk about it. Ultrasound also can be considered in some women. Breast self-exam, again, you need to know what is normal for you. So this screening, I think with VANS, it should not be done indiscriminately for women above 50. This is something I try and do in villages. In UK, when screening was introduced in late 80s, you can see that the breast cancer related deaths, the curve started diverging. The number of cancers went up, but the ladies who died of breast cancer went down. So it does actually save lives. This amazing study done at Tata Memorial Hospital with more than 1.5 lakh women actually showed that, just with a simple clinical breast exam done once a year for ladies who were more than 50 years of age, there was a reduction in deaths related to breast cancer. And for a country like ours, I think this is fantastic because this is something which any trained professional can do, because a lot of our ladies may not have access to a mammogram. Very important, you need to know what is normal for you. So you should stand in front of a mirror and look at the symmetry of your breasts, look at the nipple, look at the shape, size, contour, see if the nipple is inverted. You should know what changes to look for. If you put this on Google, you will get lots of ways as to how you should self-examine. So you must know what is normal for you. You must examine yourself once a month, about 7 to 8 days after your period, or if you've attained menopause, any set day of the month, first Sunday of the month. And see a doctor if you have anything if you see any change. The other thing we need to know is the alert signs of cancer. So a lot of patients ask me and relatives that, what can we do? How do we know that we have cancer? There is no one specific sign. If you're losing weight and you're eating fine, it could be just diabetes or thyroid issue also. But you must also know that this could be cancer as well. You have to have cancer in the mix now, because we know that the number of cancer patients in developing countries like ours, like India, is increasing substantially. If you have bleeding from any site, anywhere, it is not normal unless it's your monthly period. Even if it's your monthly period, if you are bleeding every 2 weeks or at the time of the month when you should not be bleeding, or you've stopped your periods, you've attained menopause and suddenly you have spotting or bleeding, you must go and get it checked out. If you have a cough or anything, I say that, that doesn't get better with the treatment for 2 to 3 weeks, you must rule out cancer as one of the differential. The third thing that I want to talk about is prompt treatment is very important. So we do an X-ray of the breast, or we do a clinical breast exam and we find a lump. We confirm it by doing a biopsy. We confirm that you have cancer, that the patient has cancer, and then we do some special tests called estrogen, progesterone, HER2 receptor, which actually decides what treatment you're going to have. And then we also do a scan to see from the breast, has it spread anywhere? So we check that by doing a CT scan, bone scan, or a PET scan. And that tells us that if the cancer is confined to the breast, it is stage 1 or 2. If it has gone to the draining lymph nodes, it's stage 3. And if it's gone to distant organs, it's stage 4. Then after that, the whole team sits together, puts their heads together, the surgeon, the radiation oncologist, medical oncologist, pathologist, all of us sit together in one room and we have a discussion as to what treatment the patient should have. I think very important, you must choose the right cancer center, you must choose the right oncologist and the right team. There is no rush when you're diagnosed with breast cancer to have surgery done immediately, get admitted. One should actually remove the fear or the stigma attached to cancer. You have enough time to take a second opinion or a third opinion. When you go and buy a sari, you go and see at least 5 shops. So there is nothing wrong. You must not feel guilty if you want to see another doctor. You must connect with the doctor, because I feel the relationship between a cancer patient and an oncologist is for life. So it's like a marriage. So, you have to be able to do something which I always say, shared decision making. you have to be the partner in the decisions that are being made for you. Whether you want to have breast conserving surgery, whether you want to have a removal of breast, or whether you want to have breast reconstruction, all of these options must be discussed in detail. And it doesn't happen in one visit. It takes actually 2-3 visits before you actually come to a decision about your treatment. So don't be in a rush to get admitted the same day when you're diagnosed with cancer. You have enough time. You have enough time, a week, even 10 days, to get the right opinion before you start treatment, because once you start treatment, you can't go back. So various modalities of treatment that we have, which have actually helped us increase cure rates to 90%, 95% as well in some patients, 100% literally if it's stage 1, 98 to 100% I would say, is surgery and radiotherapy, which actually cured 9 out of 10 patients. So make sure you find the right surgeon who's a breast surgeon, breast cancer surgeon, and knows how to address the lymph nodes under your arm as well. We have enough trained breast surgeons in the country now. And even if you have to travel, you must, because I think the surgery done right is very important. Radiotherapy, hormone therapy, chemotherapy, these are all medical treatments. Immunotherapy works with your own immune system. Targeted treatment. We also have bone modifying agents which help us increase the cure rates by adding another 2% to the cure rates. And of course, the word is given integrative oncology. In fact, I prescribe weight-bearing exercises and diet to my patients because I feel that decreases your risk of cancer coming back by 20 to 25% sometimes. So I think it should be given as a prescription. And of course, complementary and alternative medicines are something which we should not discount. I think we should discuss it rather than doing it on the side, because I myself would suggest that, acupuncture sometimes is very good for hot flushes. So one should actually have a discussion with the oncologist about these as well. 21st century radiotherapy is very safe. I just wanted to show you that, simple technique. Now that we've become so good at curing breast cancer, we are trying to de-escalate care without compromising outcomes. So chemotherapy, which used to be 6 months, has become 3 months. Targeted treatment, which we used to give for 12 months, now we give for 6 months. Simple thing like deep inspiration breath holding. If you see the heart, when you expire and during expiration, and then when you do deep inspiration, the heart moves away from the chest wall. And that is when, if you do the radiation beam therapy, you actually avoid the dose to the heart with radiation. And so during patients who are having chemo with me so I actually try and do pranayama with them, get them to learn pranayama, because pranayama actually teaches you deep inspiration breath holding by holding your breath for at least 30 seconds. Lot of myths. I want you all, there is about 140 of you here today, to talk about cancer. Don't hesitate. In India, what we do is we do not want to even say the word breast. It is just too private. One of the biggest taboos is you don't want to talk about it, because unless you talk about it, how will you get the tests done? Make sure yourself, your mother, your grandmother, your daughter gets these tests done at the right time. Cancer fear and fatalism are more prevalent among ethnic minority. By ethnic minority, I mean Asians and Afro-Caribbean population. The study was done and published. So I think we need to dispel this completely. It is not contagious. You can hug your child, you can hug your grandmother, you can sleep with your child. So I think these are things which I keep getting asked quite a lot. A black colored bra, a deodorant, milk, microwave, none of these increase your risk for breast cancer. And if you have more questions, I can talk about it. The chances that you're alive at 5 years after being diagnosed of breast cancer in the 60s was 38%. And now it is 90%. So it is not as good. These are Western data. So it is it is not so good in India. I would say it is still 60 to 70% for us in India. And that is because we are diagnosing the cancers very late stages. And also there is a topographical issues as well, because in Northeast India, the last data we had, the 5-year survival is 25%. And hence all the cancer centers that have come up there, which I think is an amazing effort by the Indian government to do that. So again, in Indian movies, if anybody has to die, they make sure that the patient has cancer. I think this movie, Dar Ka Rishta, was the only one which I feel was a positive movie, which showed that, you know, the patient, the protagonist got cured and came back. And that Saab made this film, I remember. He had this same experience himself as well. I think we need to destigmatize cancer through the movies as well. Most of the movies, this actually study was published and the investigators found that almost 70 to 80% movies show that patients have died of cancer. So we need to change the narrative. The perception of the public is that, you know, cancer is incurable. Most patients say that, you know, you've given us a death sentence and, you know, it's like a bomb has gone in our family, what will happen? But I think the oncologist's view is we want to cure patients or turn it into a chronic illness. This support group meeting we did with Ashish and Dr. Ashish from CMC Vellore, and I remember from VG, who runs this amazing foundation where, you know, the patient support group meetings is when we hear the real stories, when, you know, a patient who's going through the treatment meets a patient who's actually finished the treatment 5 years down the line, or sometimes 10 years down the line. And for that patient who is supported, who's going through the treatment today, it actually makes it means a lot and makes a huge lot of difference as well. So I think in summary, I'd like to say that you need to prioritize your and your family's health, take charge of it, and be proactive in doing the lifestyle modifications that we have discussed, the ABCDEFs, which are completely in your control, and talk about cancer positively. And these slides are, I mean, you don't have to be an oncologist to talk about what I have talked about. You're most welcome if anybody wants these slides to educate others or talk in schools or talk in resident welfare associations. You're most welcome to take them, and Priyadarshini will be very happy to email them to you and use them. Just, you know, talk about it and get screened. I feel that this is something which we know. There are some tests for breast cancer, it's a mammogram or a clinical breast exam. Or for colon cancer, it's a stool occult blood test. For cervical cancer, it's either a visual examination or by acetic acid or a pap smear or a HPV DNA. These are the three cancers where we know that we can diagnose at stage 0. Stage 0 means a precancerous stage, before it becomes cancer. For an adenoma in the colon to become cancer takes almost 10 years. So if you can diagnose it early by annual stool occult blood test, the adenomas can bleed, and that's what you can check in the stool occult blood test. So you can diagnose it before it becomes cancer. Similarly, with mammogram, you can diagnose a ductal carcinoma in situ, DCIS, which is actually not cancer, but you can actually treat it at the precancerous stage. For cervical cancer, you can do cervical intraepithelial neoplasia, which is before it turns cancer. And it goes through 3 stages, 1, 2, 3, before it becomes cancer. So, you know, sometimes stage 1 can actually, like I said, you know, is self-limiting and get controlled on its own. Very important, unless you get screened, you will not know about it. And one more thing I would say that, you know, HPV vaccination for cervical cancer is very important. If you have a child or a grandchild who's 10 years and above, 10 to 20 years of age, you must consider HPV vaccination, which actually prevents 80% of cervical cancers, which is the other common cancer we have in India. And don't ignore any new symptoms at any age, and especially if it is a painless lump or anything which is painless could be cancer. And of course, you know, get yourself checked by a doctor who's closest to you. Thank you. And this is the team at Balco Medical Center, who I'm really grateful to and thankful to. Thank you. So there are a lot of questions. Actually, I will, if the nipple is inverted, does it mean a breast cancer? So not necessarily. It could be just that, you know, so a lot of ducts actually in our breast go and converge on the nipple. So it could be a blocked duct, or it could be a fibrosis, but it could be cancer as well. So you must get it checked out if one nipple is inverted and the other is not. And ideally, if you are at the right age, you should have a mammogram, clinical exam, or an ultrasound. But please see somebody if you have an inverted nipple. I feel we should arrange some setup for clinical examination to check breast health. I absolutely agree that, and the Indian government has started this in a few years ago, that all women above the age of 30 years can go to their community health center or a primary health center and get breast, head and neck, and cervix examined. But it is not being done, I know, because I visit quite a few CHCs in a coordinated manner. What we do at Balco Medical Center is through the Mr. Anil Agarwal Foundation, we have this amazing setup of Nand Ghars, almost 3,000 all over the country in 12 states. So we just recently did a camp where we screened 80 women, and it's mainly clinical screening only. And we found 2 suspicious lumps. And so I think we plan to do it through the Nand Ghars, at least in Chhattisgarh, and hopefully we'll expand down the line as well. Because at Nand Ghars, they provide a lot of education, food, and support to women and children. So I think this should be done all over. Then what is the probability of having breast or chest cancer in male? I think that's a very good question. So I know the statistics in UK. In a year, we would see about 700 to 800 men with breast cancer. And so breast cancer in men is uncommon, but it can happen, and it usually has a genetic basis. So in the family, there would be a history of either prostate cancer or breast cancer, or a mother or father having had breast cancer. So if a male has breast cancer, we always do the genetic. That is one of the indications that we must do genetic testing. So even if you're a male and you have an asymmetrical breast, you must get that checked out. So then percent of white discharge when squeeze only, little somewhat like. So I think discharge, you must see if it is blood stained. It could be possibility of a cancer, or it could be just something what we call duct ectasia. So the fluid should be tested, and sometimes what they can do is they can just remove. The breast cancer surgeons are amazing these days. They can just remove that one duct, and that discharge problem will not be there. And sometimes, very rarely, you find a cancer inside the duct. So that could be ductal carcinoma in situ, or it could be nothing, So I think it's better you get it checked out. How could I know that it's gland or tumor upon self-breast examination? I think a lot of us have what I call lumpy breasts when we are young, and it's usually is fibroadenosis or fibroadenoma. So the best thing is, and sometimes these can also grow because of hormonal changes. So my advice would be to see your gynecologist or your physician and get it checked out, have a specialist examine you. And sometimes I'm able to say very confidently that I am pretty certain this is a fibroadenoma, because it's very mobile. But I would really like you to have a check ultrasound, and the check ultrasound confirms that. And sometimes it doesn't confirm that, and then you have to do another test. In a very young lady, I probably will do an MRI, especially if there's a family history, but otherwise we will do a mammogram. So best thing is to get it checked out. By simple breast exam, you can't know. So that's why I said, know what is normal for you. So once you've had an ultrasound and we have reassured you that no, these are all lumps, these are all fibroadenomas, just ignore it. Now, when that lump changes character, when you're examining every month, that's when you should go and see the doctor. It may never change character. And actually with age, as we attain menopause, they actually shrink and go away. Does fasting help in preventing cancer? So there are a lot of studies on fasting. And none of them has stood the test of time for us to, recommending fasting as a strategy to prevent cancer, especially breast cancer. But yes, there is some talk about that, avoiding sugar, milk, fasting. So I would not suggest it, but I think fasting once a week or once a month is healthy anyway, and a lot of us do it in India. But there's no concrete evidence that it prevents cancer. So my grandmother had breast cancer. So what precautions should I take? So, like I said, you must know, like my grandmother had ovarian cancer when she was 87, 86. So that would not count as family history, because as we get older, we are going to get something or the other. But if your grandmother had breast cancer in her 40s or 50s, then it's something that it may be hereditary. So it's very important to know what age they developed cancer. So if she had her breast cancer in her 60s or 70s, what I would say a post-menopausal breast cancer, then I would not take that as family history. I would say your risk is average risk. So when you turn 45, a lot of say start mammogram at 45, somebody says 50, start at some point 45 or 50, and at least have the first mammogram at 50. And then have it every 2 years. And if you feel there's anything abnormal, you have a lump or anything, get it checked out. Then would be happy to get this. Yes, we will share this. I'll just copy. PD, you can take these emails and then send the PPT, please.
Yes, ma'am.
Okay.
I've already noted.
There are quite a few emails, so just
Noted, ma'am.
now, is 3 by 5 and 3.5 by 3.5 lump become cancer and need surgery? So again, like I said, not necessarily. You may have a very large breast, which is D cup or E cup, and then if it is a benign lump, and by benign I mean it has been confirmed on ultrasound, mammo, or even a biopsy sometimes we have to do to confirm that it is not cancer. And it does not need surgery. It needs surgery if it's troubling you, if it is causing symptoms, if it is causing pain, you're not able to sleep, you're getting twinges of pain, suddenly you get up at night, because sometimes it can catch a nerve in the lung. So, but if there's any evidence that it may be cancer, you must see a oncologist and have a discussion whether you really need surgery and what type of surgery. If there is soreness and tenderness, is it a concern? So I think when you're pre-menopausal, just before your periods, most of us had this soreness and tenderness. So if it is soreness and tenderness, which is at specific times of the month, that may be normal. But if the soreness and tenderness is there the whole time and is probably getting worse, then you must get it checked out. So my mother is having a hypoechoic lesion of 2.5 centimeter by 2.6 centimeter, seen at 12 o'clock in right breast. There it is given as mitotic BIRADS 5. So I think very important, BIRADS 5 needs a biopsy. So that's the first thing you should do. And a lot of patients come to me and say that, if you touch the lump, the cancer will spread. So I try and tell them that all patients who are cured today, none of them actually went through the cancer treatment without a biopsy. So every single patient who's cured today, the 90% that I'm talking about, have had a biopsy. So without biopsy, we cannot move forward because we don't know what type of cancer you have. If you have a triple negative or a HER2 positive breast cancer, we may want to give you chemotherapy before and then do the surgery, because the results of the surgery will tell us what we need to give you post-surgery. So that's the reason why I have been able to increase the cure rates, because we are able to sequence these treatments. So you must, and for us to know whether your mother is curable, she will need a staging scan. My preference is to do a CT scan and a bone scan, but a PET scan is also fine, which is done. So that will tell you if it has spread anywhere or not. and then we can have the discussion about cure. Is HPV vaccine? Yes, HPV vaccine is available in our country, and the cost is a bit much, but we are coming up with the indigenous vaccine, which has been approved by DCGI in September, and I hear it is going to be launched in December, and that will cost about 200 to 400 rupees. Right now, it costs about 3,000 to 3,500 rupees. But I think at least if you do it between 9 to 15 years of age, your child will need only 1 dose. After that, you need 2 doses. Up to what age is HPV vaccine? So I think that the licensing is up to 26 years of age, but I would feel you should have it before sexual exposure, because the efficacy of the vaccine goes down after sexual exposure. So what are the chances of survival? So I think survival, like I said, if you early stage, stage 1, 2, the survival is almost 85 to 95%. Stage 3, it goes down, and stage 4, its 5-year survival is about 20%. So I think that's why we want to diagnose cancer early. Then, oh, Ananya, hi Ananya, lovely to see you here. Post-cancer treatment, how often do you think a PET scan is required? So I actually recommend no PET scans after treatment. The reason is all of these scans give you unnecessary radiation. And if you're looking at cure, and especially if you're young, we don't want to increase your risk of developing second cancers 10 years later, or even 20 years later. When we are talking of a cure, I want the patient to lead a completely normal life and, have a life expectancy that we have in India of now 65 to 75 in different groups. So when we talk of cure, so when we are curing you, we want to, we don't want you to get a second cancer down the line, which is what can happen in patients who have been cured in less than 1% patients. So we want to do everything to mitigate that now. Do we have to experience some kind of symptoms to need it, or should we get the scan? No, you should not get the scan regardless. So, but if you have a symptom, like I just had a patient who said that she has a lot of nausea and weight loss, and I did her blood test, her liver functions were high. So then we're getting a scan done, because, I'm worried that whether it has gone to the liver or whatever. So yeah, symptom-driven scanning is fine. Then, you have bone pain, which is not getting better with, which is not muscular. So muscular pains will get better within 2-3 weeks if you're exercising. But if it is not getting better and actually getting worse, or waking you up in the middle of the night, then I would do a scan. What should a person keep in mind while deciding upon a cancer treatment center? I think it's very important to see that that center is comprehensive. I'm not saying that the center should have radiation and everything, but they should have a mechanism of doing a virtual tumor board or some kind of a tumor board where you have the key verticals, surgery, medical, radiation, and they should be able to provide you a copy of your tumor board discussion or a multidisciplinary team discussion note. And actually, it is your right as a patient to ask for members in the tumor board as well, that who was present when this decision was made. So I think by doing all of these meetings, we want to empower the patients to be able to ask these questions, which they do in the West a lot anyway. But here, I feel that that is slightly lacking. So when you're deciding upon a center, I feel a comprehensive treatment would help. Something like Tata Hospital, like we have Balco here, and everything is available under one roof, so that your doctors talk to each other. Because constant discussion between the oncologists is very important. When I start chemotherapy, sometimes I need the surgeon to see the patient after 2 cycles. I'm not sure whether the patient is responding as well as I'd want to, whether she wants to take her up for surgery earlier rather than later. And also the accreditations matter, I feel, because there has to be some system of peer review for the center. Like for Balco Medical Center, we just got it peer reviewed at different departments by Tata Hospital, because you need to know what the gaps are in your center before you start closing them. So I think these are the main things, and also the team and the manpower and the infrastructure. The mammogram, whether the center has a digital mammogram or whether it's one of the old ones. which gives you more radiation and the quality of images are bad. So you need to check all of these, when you go there, and you should be able to ask these questions. Amazing session. I would like to ask, why are young women getting more cancers, breast? And so I think this is very important, that a lot of young women are developing breast cancer, and I have quite a few patients who are in their 20s. In fact, Ananya is one of our amazing patient advocates now, who talks to my patients who are young now. Already I've referred her a couple of patients from here. Because for a patient who's in their 20s and is going through the breast cancer treatment, it's very hard. It's things like not just fertility, marriage, but career, life, a lot of genetics. All of these things are thrown at the person by us. And it's psychologically very, very tough for, and most of the patients smile and bear it and move forward. And but I know how hard it is, and for them to be able to talk to another person really helps. So thank you so much, Ananya, for doing what you're doing, and also Prabha and Shail, you are here. So I took their names because they are very happy to help patients in talking to them and getting them through the cancer journey. So younger women are getting it. I don't know exactly what the reason is. I think we've become, maybe I have had a lot of patients who've had no risk factors at all. So we need to learn more, look into this more. But one reason could be that I'm talking generally, that we are more urbanized, westernized. So we are having children late, not breastfeeding, are in a rush to come back to work, are and also so all of these are also the early menarche, late menopause. There's nothing we can do about it, but that's the pattern that we are seeing. Also in India, we have a younger population matrix. More than 60% of our population is less than 50 years of age. So that also could be the other reason why we are having a lot of junk food. We don't exercise, we have sedentary jobs. So all of these could be some of the risk factors. There are various content available on Google to check the breast health, but we are not good enough to assure if you're doing it right. Also here in Korba, I didn't heard about a clinic to get it examined. So actually Balco has a center in Korba. Dr. Vivek is there, who is a chief medical officer. So maybe you could go and visit it. And I'm also planning a visit in November to Korba to start, we want to start a registry, a cancer registry, to understand what the problem is in our population in Chhattisgarh, and also to drive self-breast and a clinical breast examination once a year. So I would suggest you meet them, and hopefully we have made a video. Actually, I did it when I was in Narayana. So that is available on YouTube. So you could Google that and check that also. It's animated version. It's only 60 seconds and it tells you how to self-breast examine. Then I think PD, I hope you're taking the emails, and arranging breast exam camp for non-Bhar women is very good in it, but I feel it should be extended for employees as well. Of course, it should be. And please DM Priyadarshini of me, and I will make sure that this is done, especially if it is within the Balco system. What are the symptoms of ovarian cervical cancer? What's the age when it's likely? So usually ovarian cervical cancer is usually in the younger women in their 20s and 30s. And ovarian cancer is in towards 40s and 50s. But like the question was that, we are seeing more younger women with these cancers. With cervical cancer, the main symptoms are, it could be a foul smelling or a bloody discharge, or bleeding at the time of intercourse, or pain in the pelvis, which is not getting better. With ovarian cancer, the symptoms are very non-specific. So most patients with ovarian cancer are diagnosed late. But if you have symptoms of bloating, anything, abdominal swelling, you must get it checked out. So continuous pain or sudden pain in nipples, is it symptom of cancer? So usually, something that comes and goes is usually not cancer. But if it is there and it's persistent and is troubling you and is not getting better over time, you must get it checked out. So for checking to have consult gynae or cancer center, please, I think you must go locally to whichever center is local to you, a local gynecologist, and ask them to do a breast exam and a cervical pap smear as well. If someone has taken HPV vaccine first dose around 7 years before, but did not continue with the other dose, in this case, does she need to start with first dose again if she wanted to take the HPV? So I think it depends what age the patient had it. So like WHO now with Tata Hospital, they did a study and they found that for women between the age of 9 and 15, 1 dose is enough. So, but after that, I actually don't know the answer to this, whether if she wanted to take the HPV vaccine now, whether it would help. Ideally, you should give 0 months and 6 months. But I think if you've missed and if the age was more than 15, there is no harm in giving the dose now. So I would err on side of caution and give it. Does biopsy spread cancer? I have addressed that. Then my mother's maternal cousin sister. Mother's maternal, she's an unmarried woman. I had breast cancer at the age of 45. So should be all women from our family should get examined. So she is she is not your first degree or your second degree blood relative, because she's your maternal cousin, mother's maternal cousin. So I would not see that as a positive family history. But again, if you're worried, concerned, they have these lot of models, Bodacia models, and where they can put all the information and tell you your risk of breast cancer. But just by this, I don't think there is an increased risk. I had a triple negative breast cancer at the age of 72 years. Okay, so triple negative breast cancer, all patients, in fact, in UK, the guidelines were that less than 60 years of age. But at the Royal Marsden and a lot of other centers in Europe, they said any age triple negative breast cancer. So you should do the BRCA gene testing. And then your daughter should screen from the age of 50 anyway, irrespective of the triple negative. But if you carry the BRCA gene, then, after counseling, you should get this test done. Then, then we need to have a discussion with your daughters as well. Recording, I think PD will answer that. I'm getting pinching feel on lower part of the left breast. Sorry, I missed the, do I need to get it screened on the lower? So depending on how, I think if it's comes and goes, like I said, I would not worry too much. But you should get screened if you're above 45 or 50. Then can HPV vaccine be taken by female or male? I think that's a very good question, because in India, the Indian Academy of Pediatrics has licensed it only for girls, but in Europe, US and UK, it is given to all boys as well. And I have given it to my nephews, nieces, everyone. So, I mean, you can give it to your to boys as well, because it prevents head and neck cancer, oral cancer, penile cancer, in a lot of other cancers also it prevents. So I think both women and men should get it, but in the government sector, I think it's only approved for women. So Mansi, I hope you are. I think we are reaching towards the end, and I am not able to. Can you see anything PDA that I've missed? I'm not able to put this on top. Not able to scroll up.
No, ma'am, you've covered mostly everything.
Viji, you are here. Lovely to see you. Paget's disease, I think, is something which is getting common, and I think it should be addressed. it should be addressed. We talk about Paget's disease of the bone, but there is Paget's disease of the nipple also, which we have, and it is not cancer. It is benign actually, and it is very, very rare. It can cause itching and like eczema-like changes in the skin. But one should get it checked out, because it can be a sign of breast cancer in the tissue behind the nipple. So it's important that it's checked out. And sometimes the surgeons feel that it's better to operate on it, because when you look into the tissue, you may rarely find some islands of cancer as well. So if you have itching around the nipple area or nipple is inverted, please get it checked out. And my mother had breast cancer. Is there any chance of it for me? So again, like I said, we've taken that. So can use of plastics and aluminium utensils cause cancer? So again, there's a lot of talk about this, but it has not stood the test of time. There's no study to show that it definitely causes cancer. But I think in one day you hear mobiles cause cancer. So everything, if you look at it that way, everything that we have within our environment has been implicated to cause cancer. So I think just being sensible is fine. I would not use plastics anyway, just for the green initiative. And aluminium, I think the iron utensils are probably better than aluminium. Iron or steel is what we use, but there's no definite correlation that it causes breast cancer. Thank you so much. Thank you so much, everyone. It's been a pleasure to be with you. And thanks, Piri, for hosting this as well.
Thank you so much, ma'am. And thank you everyone for joining this session. And if there are any queries or anything that you would like us to address, please email it to me on priyadarshini.matthew@vedanta.co.in. I'll be here to help you, and we have noted all the email IDs down, and we will be mailing it to you shortly. Thank you so much, everyone, for joining us today.
Thank you so much. Bye-bye. Bye.